that emergency planning generally failed to account sufficiently for the pre-existing health and societal inequalities and deprivation in society, and that there was, I quote, a failure to engage appropriately with those who know their communities best, such as local authorities, the voluntary sector and community groups. I declare my interests as laid out in the register. At the time of the pandemic, I was, and I still am, the Chief Executive of Cerebral Palsy Scotland, as well as chairing the Scottish Government's National Advisory Committee for Neurological Conditions. I have also given much written and verbal evidence to the Scottish COVID inquiry under the chairmanship of the Honourable Lord Brailsford. And I share the Noble Lord Brown of Laderton's frustration that politics got in the way of the governments of Holyrood and Westminster in working together, and I slightly despair that we have to have two separate COVID inquiries running at the same time. But the conclusions drawn in this module by Lady Hallett resonate with my experience and the experience of people with cerebral palsy during the pandemic, and it is this that I wish to concentrate on this afternoon. Right from the very earliest days, cerebral palsy was cited by UK and devolved governments and in the media as being a specific condition that left you more at risk from COVID-19. This messaging, which was based at the start on very little clinical evidence, continued all the way through to the rollout of the vaccination programme, where people with CP were able to get their vaccinations early. However, it was coupled with the cessation of support services that this population rely on. It meant that people with CP and their families were left with considerable anxiety regarding what they should and could do to remain well. In March 2020, with no consultation with disabled people themselves or the organisations that support them, all face-to-face services ceased. Community physiotherapy, occupational therapy, and other AHP services were not deemed to be essential. Some adults with CP moved back to live with their sometimes rather elderly parents and family for lockdown, and some were too anxious about infection to allow carers into their homes. The inquiry's report says there was a failure to appreciate the full extent of the impact of government measures and long-term risks from the COVID pandemic on those with poor health and other vulnerabilities. These groups were already vulnerable, and yet what was essential to keep them well was denied them because such services were not deemed essential by those who were making the decisions. This reduction in services, together with restrictions that left many struggling to manage their condition, caused isolation and increased anxiety that we are still trying to recover from today, over 4 years later. Medication, for example, was seen as a priority, but physical therapy, occupational therapy, or speech and language services were not. Yet for people with CP, these are as vital to access on a regular basis as medication is for other conditions. The closure of schools, in particular, had an extremely detrimental effect not only on the children with CP, but also on their families. Anxiety levels about the risks to children with CP were such that many families did not feel confident to send their child into school, even if a place was available. But school time for these children is more than just about providing education. It is where therapy appointments happen. It benefits mental health and well-being through opportunities for social interaction, and it provides vital respite for family carers. Many children with CP have one-to-one support for their learning in school, yet families were left to cope unsupported with the demands of physical care needs in addition to educational needs. And many parents also had to juggle requirements of non-disabled siblings, or potentially trying to work from home as well. It is unsurprising that this stress had specific physical and mental health consequences. The problems caused by the lack of understanding of people with CP were starkly illustrated with the implementation of shielding. Despite Scottish Government reaching out to organisations like Cerebral Palsy Scotland, there was no coherent approach. Due to a chronic lack of data on this population, people with CP could not be identified centrally. So many approached their local GPs or paediatrician, allied health professionals or social workers to ask to be shielded, and professionals would err on the side of caution and suggest people did shield without much thought for the consequences. Many more people with CP chose voluntarily to class themselves as shielding compared to the actual numbers who received an official letter. Those people who did receive an official letter tended to have other conditions which meant they were possibly more vulnerable to COVID as a result of comorbidities rather than CP, but they were certainly more visible to health professionals and easier to identify. However, it all added to the picture of inconsistency, and we know that people fell through the gaps. People did not understand the logic of who was or who was not meant to shield, or where to go or who to ask in order to find trusted information. The picture reported to Cerebral Palsy Scotland illustrated many variations across the country, and that health and social care professionals, as well as people themselves, did not feel equipped to take decisions about their own level of risk. I particularly commend the inquiry report's recommendation 5 for improving data and research for future pandemics, and I was glad to hear the Noble Baroness Merrin addressing actions that the government wished to take on this in her opening remarks. People with cerebral palsy are invisible to service providers. The lack of a cerebral palsy register meant that although they were very visibly classed as vulnerable, health and care and education professionals did not have adequate data to identify where these people were within their communities. And given the umbrella nature of the condition, it was impossible for them to identify who actually was vulnerable and provide them with the adequate support, as opposed to those with milder CP who could be reassured and who could have been at no greater risk from COVID than the rest of the population. I hope the government will take the inquiry's recommendations seriously and will work in partnership with the devolved administrations to improve our data and planning and thus our resilience. Unfortunately, people with cerebral palsy remain invisible today, and I would welcome the opportunity to work with the Minister and her team to ensure that policymakers, service providers and professionals can identify this population so that never again will decisions about them be made in isolation with such devastating long-term consequences.